Welcome back. Well, you've probably heard of the term bad cholesterol, but did you know that too much of it can increase your risk of heart attack and stroke? My guest today is Dr. Eduardo Sanches, Chief Medical Officer for Prevention for the American Heart Association, and we're going to talk about their Lower Your LDL Cholesterol Now initiative. And he also has some tips on how people who've had a heart attack or stroke can best manage their LDL cholesterol and reduce the risk of repeat cardiovascular events. Welcome, Doctor.
Hi, how are you?
Well, how does someone know if they have high LDL cholesterol, and what should they do if it is high?
Well, really, the only way to know that your LDL cholesterol is elevated is to have a blood test done, usually ordered by your doctor or healthcare team. And then once you have that information, having a conversation with your physician about what that means, and is that LDL cholesterol sufficiently low to reduce your risk of a heart attack or stroke.
So the LDL is the bad cholesterol.
The LDL is the bad and the HDL is the good. So LDL should be lower and HDL should be higher.
Is there an optimal number for LDL and one for HDL?
I think the really important thing is for persons to get their tests done and then have a conversation with their doctor, because the characteristics of a patient make the level to which one is trying to target that lower LDL slightly different. So persons who've already had a heart attack or stroke have a lower target level than persons who may not have had a heart attack or stroke. So the really important thing is get that done and go talk to your doctor. And there might be some guidance around high, medium, and low, but the truth is talk with your doctor and have a conversation about what that means for you as an individual.
The American Heart Association recently conducted a poll to gauge public understanding of LDL cholesterol, especially among those who've already had a cardiovascular event. What did you learn from that?
So that poll was conducted by Harris, and it was supported by the American Heart Association and Amgen. And yeah, that poll was really, really interesting. Among these persons who'd already had a heart attack or stroke, 3 out of 4 of them reported having high LDL cholesterol. But only half of them knew their LDL cholesterol level or even what range it was in, and more than half of them said they weren't currently prioritizing that elevated LDL cholesterol. That is cause for concern and for a call to action. That's why this initiative is happening. People should know their LDL cholesterol, but people who've had a heart attack or stroke, really, really important that they know it, and then do the things that need to be done to lower their cholesterol as quickly as possible.
What does elevated cholesterol do to your body?
When LDL cholesterol is high, it basically accumulates. It starts sticking to the arteries in a person's body. And when too much of it accumulates or sticks on, it can reduce the flow of blood to important parts of the body, the heart and the brain. And if way too much accumulates, it can totally block the flow of blood. When it happens in the heart attack, when it happens in your brain, stroke, those are bad things. The good news is knowing LDL, lowering LDL can reduce that accumulation and reduce the likelihood that such an awful thing might happen.
I don't know, I'm trying to picture all of that accumulating in arteries and veins.
Well, think of a hose. Think of a hose that you can collapse, and while collapsing it is coming from the outside, the effect is the same. You can block a hose to where no water's coming out on the other end. That's a heart attack or stroke if it's your coronary or cerebral arteries and it's happening from the inside.
And what can be done to lower the LDL cholesterol levels and sort of clean out the hose, if you will?
The most immediate way is to be on medications that help lower LDL cholesterol levels. And why that's really important is that the risk of a heart attack or stroke almost immediately comes way down. And so one can immediately change the likelihood that a bad thing is going to happen in the future. There are some things that can be done with physical activity and dietary change. those take much longer to happen and take a degree of discipline that takes a while to get to. So really, really important that the message is know your LDL, lower LDL. It is probably, in the case of most people, going to require medications on the front end and then some modification perhaps as time goes on.
Doctor, where can we go for more information?
One can go to heart.org/LDL, where you will come to the Reduce Your LDL Cholesterol Now website, sponsored by Amgen, presented by the American Heart Association, in the name of longer, healthier lives, as you said.
All right, everyone, so let's get our cholesterol checked. My guest has been Dr. Eduardo Sanches, Chief Medical Officer for Prevention for the American Heart Association. As always, be sure to consult with your doctor. Dr. Sanches, thank you so much for joining me.
Thank you so much for having me.
I'll be right back.